Here's a look at the 8 things you need to know today. The flu is making its way around the UW-La Crosse campus and the community as a whole. News 8's Madeline O'Neill has more on what you should know to stay healthy.
Lisa, there have been a lot of illnesses going on around campus and in the area lately, including influenza. And medical professionals say this year may be a particularly nasty one for the flu.
I have had a couple of friends that have had it.
The flu is making its rounds on campus.
One of my classmates today actually texted me and said that he wasn't coming to class because he was sick with the flu, so glad he didn't come to class,
Students say they have their methods of staying flu-free.
I wash my hands.
Just practicing good hygiene and keeping my distance from people that are sick.
But on a campus of about 10,000 students, you can only keep your distance for so long.
Influenza is very contagious, and the more that students are going to class when they have a fever and they have influenza, the more students are going to get influenza.
That's why the university's health center has sent out an email to faculty and staff, alerting them that over the past 2 weeks, more and more students have been coming in with the flu.
So that they will be a little bit maybe more understanding of a lot of students contacting them that they're ill.
The flu isn't contained to just campus. Gunderson Health System doctors have also seen more patients with the flu.
We anticipate that it's going to be a rough year for influenza because H3N2 is the one that's circulating, and that's the one that tends to hit the very young and the very old, and it's very aggressive when it hits.
There are tips to fend off the flu.
Get an influenza vaccination, but beyond that, using good hand sanitation by washing your hands frequently, using hand sanitizer, covering your coughs. But of course, when people are in close quarters, it's going to spread very easily.
One last method students have to stay healthy: a solid dose of hope and luck.
I personally haven't got it yet, so I'm keeping my fingers crossed.
If you do get the flu, doctors recommend the classic advice: get plenty of rest, drink liquids, and take over-the-counter medications.
Okay, so now that everybody knows that it's here and people are feeling a little nervous, is it too late to get the flu shot?
It's not. I know because I got mine today. I have the Band-Aid to prove it here, and I hate needles, so you can too, and I recommend it because they say the flu this year can put you out of commission for like 5 to 10 days.
All right. All right, thanks so much, Madeline.
You're welcome.